With a brief introduction, Dr. Porkale will hand over the session to you, sir.
Sure.
And after the session, we can have the discussions. Participants will post their questions in the chat box.
Okay.
And you can answer them, sir.
Yeah, sure.
In between, if you want any assistance, Porkale as well as me will be there in the meeting itself.
Okay. Do you have my number?
Yes, sir. We have the our coordinator
is
has
there
the
any
number.
internet problem or any technical issue? Means you can contact to my number.
Yes, sir. Sure.
Okay.
Okay, sir. Thank you, sir. It's great having you.
Learning is the beginning of wealth. Learning is the beginning of health. Learning is the beginning of spirituality. Having a great heart to start learn is where the miracle process all begins. Good evening, everyone. With great joy and immense pleasure, my warm welcome to all the dignitaries, guests, and delegates present here for Dr. Sudarraj N. Memorial free webinar series organized by DIKSHA E-Learning in association with Ayurveda College Coimbatore under the banner of Azadi Ka Amrit Mahotsav. In today's session, we will be discussing about pindasveda's Keraleeya Specialities and its clinical dimensions by Dr. Navaneeth Krishnan. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly. And if the problem is with our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any question can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. Next, I would like to invite Dr. Neetu, Assistant Professor, Department of Kai Chikitsa, Ayurveda College Coimbatore, to deliver the welcome address. Over to you, ma'am. Sorry, ma'am is unable to join us. It's a great pleasure for me to introduce our guest speaker, Dr. Navaneeth Krishnan. Dr. Navaneeth Krishnan sir is currently working as Assistant Professor, Department of Kaya Chikitsa, Vaidyaratnam Ayurveda College, Ollur for past 7 years. He was the coordinator and presenter of Prayoga Kalpa, organized by Vaidyaratnam Aushadashala, and e-Vishruta online series on Keraleeya Aushadha Yogas, which was too much beneficial for young Ayurveda doctors. He serves as a main faculty and organizer of different national workshops, training programs, finishing schools, organizing at Vaidyaratnam Ayurveda Foundation. He was the co-investigator of extramural research project granted by Department of Ayush, which was held at Vaidyaratnam Ayurveda Foundation. He has also been a resource person for many scientific sessions held inside and outside Kerala. He is the author of the book named Keraleeya sveda Vidhi or Prayogika Samipanam, and also published many scientific papers in national accredited journals. He has been in the field of clinical practice, academics, and research of Ayurveda for the last years. And we are extremely privileged to have you here in this platform, sir. Now, without any further delay, we will turn the time over to respected Dr. Navaneeth Krishnan to enlighten our minds with his knowledge. Over to you, sir.
Thank you, Doctor, for the introduction. Am I audible?
Yes, sir, you're audible.
Yeah, my sound is clear now.
Yes, sir, it is clear.
Okay, okay. So shall I share my PPT?
Yes, sir, you can share.
Is it visible now? Doctor, is it visible?
Yes, sir, yes, sir,
Yes,
it's
sir.
visible.
Okay, okay. Okay, thank you. First of all, my humble pranams to Dr. Sudhir sir. Then my sincere gratitude to team DIKSHA for giving me such a wonderful chance for sharing something in front of a scientific community. Thank you once again. And starting with my session, pindasveda, Keraleeya, Vaivithya, and Prayoga. First of all, we have to start with the importance of sveda and what is pindasveda. As an introduction, we have to discuss regarding that. While we are moving to the importance of sveda, we have to approach the importance of sveda in a three-dimensional view. Sveda is having social importance. Why? Because of course a lot of people we are accepting, or we are moving through a particular lifestyle now, especially what we can say, like taking more food or without proper exercise, means a sedentary lifestyle we are following now. So of course, for enhancing the metabolism, the Svedana type of Langhana therapies are important, especially in Kerala and all. every year, especially in the month of Karkadagam and all, we are more focusing to the healthy aspects, and we are doing some like Ayurvedic therapies in that period. Periodical Svedana therapies and all will be helpful for maintaining health, and as well as for the prevention of such especially like joint disorders, neurological disorders, etc. And uh, while we are coming to the Kerala specialty of Sveda, the climate is also important, because here we are means in between 18 to maximum 38 degree, like we are getting here in Kerala. So it's a generally this climate is good for doing Svedas. Maybe in summer season 1 or 2 months it will be difficult in some patients, especially who is having pitta prakriti. They will have some reactions, but in general, or in all other months, we can do like Svedanas logically. And third point, the clinical importance of Sveda. Clinically, when you are going, when we are conducting a survey study in all over the Kerala, or even all over the India, in Ayurveda hospitals, maybe more than 70% or more than 80% we are doing Svedana karmas there. Maybe we are getting more neurological or joint disorders cases more, and of course Sneha and Svedas are the primary therapies that we have to adopt in those cases. Maybe due to that, we are doing Svedanas more in all aspects. That's why there should be a critical analysis, both in preparational view and in clinical view. In a physician's mind, it should be a thorough knowledge. There should be a thorough knowledge regarding Svedanas. Then, while coming to pindasveda, pindasveda is also known as Sankara Sveda. Maybe in we can see different types of Svedas in different classics. In Ashtanga Hridaya, there you can see 4 types of Svedas. In Charaka Samhita, 13 types of Svedas are there. There and all, like you can see either Pindasveda and Sankara Sveda. In Ashtanga Sangraha, you can see a quotation Pindasveda and Sankara Svedas, both are same, like that quotation you can see. So what we are doing in Pindasveda, like their medicines either tied in cloth in the form of a bolus of the medicine, or otherwise the medicines directly taking and applying on the body. And here the Pinda means, of course, bolus, and Svedana means, of course, the sweation therapy or sweating treatments. Then it's a type of Sagni Sveda. And see, when we are moving to the more deeper aspects of Pindasveda, there you can see Vastrandarita Pindasveda and Avastrandarita Pindasveda. Vastrandarita means there we are the medicines we are keeping in a cloth and tying like a bolus and applying on the body. And Avastrandarita means there directly that medicines like making a bolus and directly applying on the body. See here, as a Kerala specialty Pindasveda, this first method, Vastrandarita type of Pindasveda, we are doing more. And a lot of varieties are there for Pindasvedas for different purposes. See, as I told, you can see in classics, different types of Svedas we can see in classics. Agni Svedam and Niragni Svedam is there. Tapam, Ushmam, Drava, Upanaha, like that. In Ashtanga Hridaya, you can see 4 types of Svedas. while coming to Charaka, of course, there is 13 types of Svedas are there. But when we are thinking practically, these 13 type in this 13 type of Svedas, maybe 2 or 3 Svedas practically we are doing in our clinical practice. More than that, it's a theoretical knowledge. And see here, next division, Ruksha, Snigdha, and Snigdha. This division is having more importance, especially in a clinical point of view. Why? Because see how we are selecting a particular Sveda by assessing the Rogavastha or Doshavastha, or by examining the Rogi. So for that purpose, this division is important. For example, if a patient is having ama symptoms more, means of course we have to select Ruksha type of Svedas. If a patient is having Vata Kaphaja symptoms, means of course we have to select Ruksha Snigdha type of Svedas. And if it is more Kevala Vatika, means we have to go for Snigdha type of Svedas. So this division is important in a clinical point of view. And last division, Shamana Sveda or Shodhana Purvaka Sveda. That division is also important in a clinical point of view. See, Shamana Sveda means as a part of our treatment, we are selecting a particular Sveda for a particular disease condition, and that for a particular duration, we are giving that sedation therapy. So here, as a primary line of treatment, we are selecting a different type of Sveda. But as a when we are doing as a part of Shodhana therapy, it is a Purva Karma to the Shodhana therapy. For example, there and all, generally maybe Drava Svedas or Ushma Svedas we are adopting more. For example, steam like Svedanas are adopting or doing or giving for the as a Shodhana Purvaka. As a Shamana, of course, different varieties are there, starting from Valuka Sveda to the Shastriya pindasveda. So here in this session, we are more focusing to the Shamana Svedas, especially Shamana Pinda Svedas. While coming to the importance of pindasveda, it is generally pindasvedas are more feasible and more practical to do. As I told, especially in Kerala, different varieties are there for the pindasveda, and comparatively it is less expensive, except some procedures like Shastriya pindasveda, especially Sakshiram Shastriya pindasveda or Sakshiram Samisham Shastriya pindasveda. These procedures are generally more expensive, but comparatively all other pindasvedas are less expensive, and generally a pindasveda, except Shastriya pindasveda and some other type of pindasvedas, within means 3 days or 4 days we are changing the totally. So that also will be helpful for reducing the expense. So it is more feasible to do, it is practical to do. Different types of means variations are there. So maybe by the availability of medicine, by the availability of means by the availability of medicines, or by assessing the exact doshavastha, we can select the particular pindasveda for that particular patient. Now, coming to the Ruksha, Snigdha and Snigdha type of pindasveda. Of course, in Ruksha type of pindasveda, we can include Valuka pindasveda, Churna pindasveda, and some other type of Kerala specialty treatments like Avikiri. Avikiri means Ushma pindasveda. The more discussions will come in next slides. And even some there is a procedure in Kerala, we will call it as Mukkikiri. Mukkikiri means Drava pindasveda means they're dipping the pottery in a particular drava dravya and doing the procedure. That procedure we are calling it as mukikiri. We can call in Ayurvedic terminology, we can call drava pinda sveda. And see here, while coming to ruksha snigdha, when we are applying the oil on the body, and when we are dipping the pottery in the oil and applying on the body, that procedure we can call it as satailam, with tailam, satailam, churna pinda sveda, then patrapotla sveda, Jambira pindasveda. These type of procedures we can include under ruksha snigdha type of svedas. And in snigdha type of svedas, shashtikashali pindasveda, annalepa, like that procedures we can include. See here also, as I told, the ruksha type of svedas are indicated more in amavastha, especially with predominant ama symptoms like aruchi, Agnimandyam, Aruchi, Trishna, Alasim, Gavravunjara, like that, Amavatasya Lakshanam. Like that symptoms, Ruksha type of Svedas we can adopt. Luksha Snigdha type of Svedas are more indicated in Vata, Kaphaja type of procedures, type of diseases or disease conditions. Snigdha will be more indicated in Kevalavatika or in a degenerative type of disease conditions. And of course, there are different varieties in Kerala, like Mudira Phasma or Kulatha Phasma Kiri, or Satailam Shashtikashali Pindasveda, or Chinja Lavana Sveda, Gothum Pakku Pindasveda. All the descriptions will come in next slides. Yeah, see here, while we are approaching this pindasveda in a scientific manner, of course, there should be some classification or there should be some categorizations in pindasveda. See, when we are grading these procedures from ruksha to snigdha, that pattern will be like this. See, first and foremost, the most ruksha type of pindasveda will be Valuka pindasveda, and next one will be the ruksha pindasveda, ruksha churna pindasveda. See, here we have to understand. First of all, we have to understand what is snigdha. What is that term that snigdha means? See, generally in our mind, snigdhada means oil or oily nature. It's completely, it's not like that. See, if dravamsha is increasing, we can say snigdhada is also increasing. When you are going through the Padartha Jnana, there you can see the definition of snigdha. Definition of snigdhata is Churnadi Pindi Bhava Hetu Sasnigdha. Churnadi Pindi Bhava Hetu means a binding factor in between two like molecules. So that binding factor is known as snigdhata. So for example, when we are making a roti, like we will take the atta powder. It is completely ruksha. When we are adding some sort of water into that, there you can see that binding factor. So when dravamsha is increasing, we can consider it as that snigdhata is also increasing there. So comparing to ruksha churna pindasveda, as I told, ushma pindasveda or avikiri. In avikiri, how we are heating the pottery, using this steam, we are heating the pottery. Using this steam, we are heating the pottery. So that's why we can say, comparing to ruksha churna pindasveda or comparing to Valuka sveda, this ushma pindasveda or avikiri is little bit that snigdha. And while coming to the drava pindasveda means the mukikiri. Mukikiri means there the pottery we are dipping into a particular liquid or drava dravya, and that potally we are applying on the body. So here again, the watery nature is increasing. So that's why we can say again, snigdhata is increasing. See, generally, Ushma pindasveda and Drava pindasveda means Avikiri and Mukikiri. Generally, we are doing as Ruksha, means without applying the oil, we are doing the procedure. If we are applying oil and doing means again, that snigdhata will increase. While coming to the Satailam Churna pindasveda, here oil is coming. It's comparing to all other pindasveda, Satailam is more like snigdha, or we can say it is ruksha snigdha. And here, see how we are doing the procedure. Satailam Churna pindasveda means, first of all, whole body abhyanga we will do. After that, already prepared potally, we will heat in taila, and that potally we will heat and applying on the body. Then Jambira pindasveda, then Patrapinda. These all these procedures are ruksha snigdha. In Jambira pindasveda and Patrapinda also, same procedure, means first of all applying the oil all over the body and heating the potally in oil and applying the body on the body. And under pindasveda, Shashtika Shali pindasveda and Annalepa. So while comparing to Jambira pindasveda and Patrapinda, under pindasveda is more snigdha and brahmana, we can say. While comparing to Shashtika Shali pindasveda, means when we are comparing Shashtika Shali pindasveda to under pindasveda, Shashtika Shali pindasveda is more the more snigdha, and while comparing to Annalepa with Shashtika Shali pindasveda, Annalepa is more snigdha. So this is a grading from ruksha to snigdha. This grading will be helpful for selecting a particular sveda for a particular patient or for a particular disease condition. See, it is difficult to say this a particular sveda will be effective for a particular disease. More than that, actually we are treating not the disease, we are treating the patient. So there we have to assess in which fraction of that disease that patient is coming to us. To that fraction, we are giving the internal medications and external therapies. So accordingly, we have to select a particular sveda from this group. So here, the logical selection of pindasveda, how we are selecting, as I told, to in which avasthas we have to select particular svedas. See, in amavastha, there, as I told, ruksha pindasvedas, of course, Valuka svedas will be more beneficial in predominant amavasthas, especially with as I told, Agnimandyama, Ruchi, Krishna, Alasim, Gauram, Jula, Apagashunadangana, Amavasa selection. So in those cases and all, of course, the Ruksha pindasvedas will be helpful. There, Valuka sveda also will be helpful. If that condition, if we are assessing that condition as kapha, vata predominant condition, means there also Ruksha type of pindasvedas like Churna pindasveda or the Valuka pindasveda will be helpful. But if we are assessing that condition is vata kaphaja, how we can differentiate kapha vatika and vata kaphaja conditions? See, kapha vatika means, of course, for example, cervical spondylitis. Cervical spondylitis in a younger age, that we can consider as a kapha vatika condition. Same thing, if it is happening in a degenerative age, means, of course, there will that condition may be kapha vatika. So there, ruksha snigdha type of therapies like Jambira pindasveda, or Satailam Churna Pindasveda, like that treatment will be helpful. But if you are considering it as Kapha Vatika condition, means of course Churna Pindasveda or Valuka Pindasvedas you can adopt. Then if it is a Vata Paitika condition, means generally Sniktha Pindasvedas, for example Satailam in Gouty arthritis and all, we are giving Satailam Shashti Pindasveda. It's a variety of Shashti Pindasveda. Descriptions will come in next slides. While discussing Shashti Pindasveda, we can discuss it more. Or otherwise, Dravasvedas, maybe Kashaya Dhara, Kshira Dhara, like that treatments will be helpful in Vata Paitika condition. In a Kevalavadiya condition means, of course, there will be some degenerative changes. There, Brahmana type of Pindasveda will be helpful. For example, Shashti Pindasveda or Sakshiram Samisham Shashti Pindasvedas. Like that, treatments will be more helpful. Sakshiram Samisha means along with Shashtika, we are adding Samisham, Mamsa or Mamsarasa, we are adding and preparing the bolus and doing the procedure. The more descriptions will come. Then, if that condition is what Kapha Paitika, in Kapha Paitika conditions, generally Svedas are not indicated, Pindasvedas are not indicated there. And if that condition is Pitta Kaphaja, there also Pindasvedas or Svedas are generally not indicated. While coming to the general considerations for doing the Pindasvedas, timings are important. Means generally in morning hours or in evening hours we are doing the Sveda karmas, like in Vaidratnam from 6 o'clock to maximum 10 or 11 o'clock we are doing the procedure, and in the evening hours from 3 or 3:30 to maximum 6 o'clock we can give this type of Svedas. Climate is important. Generally in a high summer season or high temperature, like Svedas are contraindicated. Treatment room is important. It should be properly ventilated. Don't do in an open space. In some some advertisements and all, maybe in related to some resorts and all, you can see all these Sveda karmas are doing outside the hospital and all. That type of practice is not good. Especially while doing Shashti Pindasvedas and all, there means if body is contacted means to a cold breeze just immediately after the procedure, there is chance for some complications like shivering and all. So those should be avoided. Then diet specifications are there, like comparatively, Sveda means it's a heat application, so there is chance for increasing the pitta. So while doing the Sveda karmas, generally more spicy type of foods are not indicated. Then Vihara specification means, of course, before going to Sveda karmas, Mala, Mutra, should means with Vegadharana, if you are doing treatment means Sveda karmas means it is not indicated. And then while doing the Sveda karmas, daytime sleep should be avoided. There is means if daytime sleep means, of course, kapha increase will be there, or there is if ama is there for that patient, means that ama also will increase. Means nighttime patient should sleep properly. Daytime sleep should be avoided. Vyayamas, maithunas, like that should be avoided during the treatment time. And in Kerala, a practice is there known as Pati Kashayam. Just before the treatment, before the Sveda karmas, giving some kashaya, especially Gandharvastadi kashaya we are giving for the Vata and Lomana. We are giving Gandharvastadi especially on the droni. Pati means droni. So on the droni, giving just before the treatment, giving some internal medications for taking. So that procedure is known as Pati Kashaya. In some practice or in some tradition, they are following this Pati Kashayam. Then Talam is important. Talam is important means maybe due to, of course, there is we are applying the heat, so there is chance for some reactions inside the body. So for the temperature modulation or modifications, we are doing talam according to the condition of the patient, ruksha snigdha or snigdha type of talam or head oil we are applying there. Then positions are important. Positions as a physician, as a doctor, we have to prescribe in which positions we have to do all these treatments. Maybe in back pain cases and all, some positions should be avoided. So accordingly, according to the patient conditions, some positions we can exclude and some positions we can include. Then post-treatment care is also important. Patient should go to room and patient should take proper rest. There should not be too much AC, air condition, or too much cold breeze inside the room. And after proper resting only, we are advising them to take bath, and the taking bath should be in hot water. So these are the first 10 pindasvedas that we are discussing in this session. Valuka svedam, churna pindasvedam, ushma pindasvedam, drava pindasvedam, then satailam churna pindasvedam, then jambira pindasvedam, then patrapinda, then anda pindasvedam, shati pindasvedam, and annalepam. These 10 procedures we are discussing in this session. While coming to Valuka sveda, what is the importance of Valuka pindasveda? As I told, it is more indicated in Amavastha, and in a Kapha-Vatika predominant condition also we can go for Valuka pindasveda. And what is the importance of Valuka pindasveda? See, Valukam means sand. Generally, the heat holding capacity of Valukam is comparatively high. Comparing to Churna pindasveda, the Valuka is having more heat holding capacity, and when we are doing 45 minutes of treatment, that I forgot to say, generally the 7 positions we are following generally we are following in all the Sveda karmas. Means 7 position means starting from the sitting position, then supine position, then right lateral position, then again supine position, then left lateral position, then again supine position, then again sitting position. So 7 positions generally we are following, or we are adopting for doing Abhyanga or Swedas. So see here, sitting positions, 2 times sitting positions will come, and 3 times supine position will come, and 1 right lateral and 1 left lateral. So total 7 positions we are adopting for doing Swedas. So, and for each position, generally we are adopting 5 minutes for doing the Sveda. So total it will be 35 minutes. So when we are doing 35 minutes Valuka pindasveda in a particular patient, comparing to Churna pindasvedas and all, here the heat holding capacity will be more. So when we are heating a potally, means more time we can give Sveda to that particular patient. So number of changing the potally or number of heating the potally will be comparatively less in case of Valuka pindasveda. So parallelly, the sveda effect also will be high in case of Valuka pindasveda. So this is the importance of Valuka pindasveda. And for a potally, as I written in this slide, you can see that 20 grams of that sand or Valuka we have to take for a single potally. So generally in like more authentic hospitals and all, for doing svedas, 2 therapists will be there on 2 sides of the throne. So there should be 4 portalies for doing the treatment. If only 1 therapist means 2 portalies are enough. If 2 therapists means, of course, there should be 4 portalies. So in each pottery, 20 grams of Valuka should be needed. Then see, Valuka should be heated and filtered. That type of Valuka we have to use for the for making the pottery. And generally, the sand or Valuka collecting from seaside will be more effective comparatively. Why? Because there will be some lavana rasa also will be there with that Valuka. So if you're collecting the Valuka from seaside, that will be more effective for a amavastha and for a kapha vata avastha. See, as I told, in amavastha we can use sometimes some patients will come, there will not be predominant ama symptoms, but still if when we are going through the lifestyle pattern of that patient and all, we will suspect some amas there. So if we are suspecting a lean amatwa in a particular patient, of course there also Valuka sveda we can adopt. As a post fever issues, even in Chikilsa Manjari and all, in Jwara Chikilsa, you can see Manal Varuttu Kachuga, like that treatment modalities we can see. Means Manal Varuttu Kachuga means frying that sand or Valuka and then making the pottery and doing the procedure. Of course, in neurological autoimmune disorders and all, in primary stage, it will be better to start with Valuka pindasveda. There may be chance for amavastha, especially in stroke cases or in some other neurological conditions. Suddenly, the activities of that patient will stop, and there is chance for an unmetabolized syndrome there. And unmetabolized syndrome means, of course, it is ama. So there is chance for amavastha there and all. Like if you're starting with Valuka sveda means that will be better. In Pratyaksha Kapha Lakshanas also we can adopt Valuka pindasveda in Kaphajwaram, in Kaphavatika Kasam. As I told, in Vishuchika Chikilsa, in Chikilsa Manjari, you can see this Manal Kiri or Valuka pindasveda. So in these different indications, we can use the Valuka pindasveda. Then while coming to Ruksha Churna pindasveda, see here some churnas for making the pottery. Those some churnas are directly available in pharmacies. For example, Kolakulathad churna or Kotamchikad churna or Jadamayad churna. Like the churnas are directly available in market or in pharmacies. If it is not available, means of course Navadhanya we can adopt, or otherwise Kulatha and Lavana for means when we are using a dravya, the means frying and powdering, and then we have to make the pottery. So kulatha alone or kulatha plus lavana we can use, or otherwise kulatha metika plus lavana, like that we can use. Otherwise chama means nandi mukh or little millet. Chama also we are using in our practice, especially in a sudden pain, and all, we are using this chama for means as an emergency sveda, just for heating and applying. We are using chama there. Then Shatahupa or Shatahua we can use. Priyangu, Tila, Tavida. Tavida means Tusha or Bran. Like Tavidukiri. So comparatively, see here you can see according to the selection of the Dravya, the Rukshata and Snigdhata will change. When we are selecting Tila, their Snigdhata is high. When we are selecting Tavida or Tusha, there also some sort of Snigdhata is there. So sometimes for the Ruksha Churna pindasveda, sometimes Pinyaka also we will select. So Pinyaka is comparatively Snigdha. So according to the Dravya that we are selecting, the Ruksha nature and Snigdha nature will change in Ruksha Churna pindasveda. But in Valuka Sveda, it's not like that. Valuka Sveda is completely a Ruksha Churna, Ruksha Pinda Sveda. That's the in that third point you can see Ruksha will change according to the nature of Dravya selected for the pottery. These are the indications for Churna Pinda Sveda. Heat holding capacity may be less comparing to Valuka Sveda here. Here also in Amavastha we can give this pindasveda in this Ruksha Churna pindasveda. In Prathana Vata Vyathi we can give this Churna pindasveda, this Ruksha Churna pindasveda. See Tusha potali sveda in Pakshakhada. I think in Kerala one tradition is the Vaidyamatham tradition is there, Vaidyamatham nursing home is there and all. This Tavidukiri or Tusha Pindasvedam is using more, especially in neurological disorders like Pakshakhatam. Even in a primary stage itself, they are starting with Tusha Pindasveda. Chama in acute pain, as I told, Chama in acute pain. Sometimes during the night call, maybe due to high pain and all, there we are adopting the Chama potali sveda. Chama means, as I told here, this Nandi mukh or little millet. That Dravya we are using, tying in a potali, and we are giving heat using that potali. Well, coming to the Avikiri or Ushma Pinda Sveda. Here you can see that picture there. Here the potali, as I told, here the Dravamsha is increasing. So when Dravamsha is increasing means we can say comparatively Snigdhata is also increasing. So in case of Ushma Pindasveda, according to the disease condition, we can go for Ruksha, means without applying the oil, or with applying the oil we can go for this Ushma Pindasveda. Then yes, okay. So here using the steam from the from a particular dravya, we are heating the potali. So for that heating purpose, sometimes we will use this one. We will use dhanyamla, or sometimes we will use some other dravyas like balakashaya or gomutra, like that dravyas we will use for the heating purpose according to the patient condition. So here the specificity of methodology will be here the heating the pottery using the steam. Okay, so these are the indications of Ushma, Pinda, Sveda. Sniktha, according to, as I told, Ruksha or Ruksha Sniktha, according to the Dosha Avastha or Roga Avastha. If more predominant ama symptoms are there, means there we can go for Ruksha type of Avikiri or Ushma Pinda Sveda. If you're considering that condition as Vata Kaphaja, means there you can go for by applying the oil, we can go for Ushma Pindasveda. See, generally in Amavastha and all, as a primary treatment, we are not selecting the Avikiri. Maybe after 7 days of 7 days of this one, the 7 days of Valuka Sveda, then we will move to 7 days of Ushma Sveda. Then maybe next treatment will be next procedure will be Mukhikiri. In next stage of Amavastha, we will move to Mukhikiri. According to by assessing the Amavastha inside that body, maybe means sometimes in some cases it will take long time for Amapachana. So till that we have to give different types of Ruksha type of procedures and Pachana type of medicines inside. Sometimes in some cases 57 days in our college for one patient we took almost 2 months for Amapachana purpose. So till that 60 days or 57 date exactly, I think. So till that 57 days we did different types of Ruksha type of procedures. We started from Valuka Sveda there. 7 days of Valuka Sveda we did. Then we moved to Ruksha Churna Pinda Sveda. Then we moved to this Ushma Pinda Sveda. Then next procedure means Drava Pinda Sveda, means by dipping the pottery into Drava Dravya and doing the procedure. That also we did for a particular time. So like that 57 days we did only Rukshada over there. Along with that different types of vastis also we did, means especially Vaitarana Vasti, Vaishwarana Vasti, like that Ruksha type of vastis also we gave. And then internally also different types of Kashaya, starting from Chitragadi, Amrudottaram, like that Kashayams also we gave inside. So we can't say within 7 days we can move to next. According to the Amapachana, we have to change our procedure. So these are the indication of this Ushma Pinda Sveda. Then Drava Pinda Sveda. Drava Pinda Sveda means Mukhikiri, means as I told, some questions are there. I think that we can discuss now itself. One question, 20 grams. Sorry, not 20 grams, 200 grams. I think in that slide I included like that only. 200 grams of churna or valuka is needed for making the pottery. Chama means tiger millet. Maybe, I think, maybe my mistake. Then next question, can you suggest any sveda for kaphaja kasa other than Ushma Sveda? Of course, see here, Valuka Sveda is enough. Valuka Sveda we can use there, or Valuka plus Lavana. That mixture also we can use for the Kaphaja Kasa. Yeah, of course, other than more than Nadi Sveda, in some cases, in some predominant Kaphaja type of Kasas, we will give Valuka Svedas or Lavana Pinda Sveda, or sometimes in some cases even we will use Tavidukiri. Tavidukiri means using Tusha making the pottery and doing the procedure. That also we are adopting according to the disease condition. Okay, thank you. Moving again to Dravapinda Sweda. Dravapinda Sweda Mukikiri. Mukikiri means here dipping the pottery, churna pottery to some particular drava dravyas and doing the procedure. Here, comparing to Valuka Sveda, Churna Pinda Sveda, Ushma Pinda Svedas and all, there for 3 days or 4 days you can use same pottery just by opening the pottery and mixing the powder and again tying. We can use for 3 to 4 days. But in case of Dravapinda Sveda or in case of Mukikiri, we have to change every day. We have to change the pottery. And one more specification is here in case of Mukikiri. See, in Valuka Pinda Sveda, in Churna Pinda Sveda, in Ushma Pinda Svedas and all, when we are making the pottery, 2 layers of cloth we are using. But in case of Mukikiri and Shashtrika Pinda Sveda, 1 layer of cloth we are using. Why? Because of course there will be some the dravyas inside that Pinda Svedas will comes out and direct contact to skin and absorption. There is chance of some absorption over there. So for that purpose, single layer of cloth we are using in case of Mukikiri or Dravapinda Sveda. And for the dipping purpose, the handle size of that pinda means that pottery should be 6 angulas. Comparing to for other Churna Pinda Svedas or Valuka Svedas and all, 4 angula is enough. In case of Mukikiri and even in Shashtrika Pinda Sveda, it will be better to have 4 angulas handle size. See, there you can see 2 special type of Mukikiri like Kulatha Bhasmakiri and Amrita Kadikiri. This Kulatha Bhasmakiri and Amrita Kadikiri, these 2 are specialities from Adivaitia Shala Kottakkal. See, in Kulatha Bhasmakiri, the Kulatha is frying and powdering, and that powdered kulatha is mixing with bhasma. Bhasma means cow dung. The bhasma making from cow dung, mixing the kulatha and bhasma in a particular ratio, means maybe 3:1 or 4:1 ratio, and that pottery is dipping in dhanyamla, or maybe sometimes in chinja patra swarasa or chinja boiled water, or sometimes in balakwatha, this dipping and doing the procedure. It will be very effective in sarvanga shop condition, sarvanga shopha with amavastha, like that condition. This kulatha bhasma pottery sveda will be helpful even as a part of obesity management. Maybe of course udvartana type of treatments we are doing in primary stage for the obesity management. In later stages, you can adopt this Kulatha Bhasma Kiri even for the fat reduction also. But see here, direct contact with skin is there, so there is chance for the reactions. Maybe some itching, like that reaction chance is there. So proper observations should be there when we are doing, especially as Ruksha. And next one is Amrita Kadikiri. Amrita Kadikiri means Amrita means Chittamrita, means Guruji itself. So here making by mixing Dhanyamla and Guruji Kashaya, to that mixture we are dipping the pottery and doing the procedure. Here it's especially doing in a Vata Rakta condition or Rakta Vata condition or Vata Rakta condition. This Amrita Kadikiri we are adopting more. So as I told, every day we have to change the pottery here. One layer of cloth we have to use the same as Shashti Shali pindasveda. See, in Valuka pindasveda, in Churna pindasvedas and all, there means using that pottery, we are means vibrations we are giving on the body. Particular means touching or vibration like that procedure we are following in case of Valuka pindasveda or in Churna pindasvedas and all for the heating purpose. In case of Drava pindasveda, here same like Shashikashali pindasveda, we are by squeezing that pottery, we are doing massage using that pottery all over the body. Like that procedure for we are following in case of Mukikiri or Drava Pinda Sveda. How is Kulatha Bhasma is made? I think already I answered that. You mean after burning the cow dung, cake and ash left is Bhasma? Yeah, same thing only. Burning means frying, and after that in sunlight again we will keep for a particular period, then powdering and using as Bhasma. So moving to next. Sorry. Yes. Yeah, as I told, this Mukikiri or this Dravapinda Sveda is using. You see here also, sometimes in as a management of obesity and all, if we are assessing the Amavastha, if there is no a predominant Amavastha, there Ruksha Sniktha type of procedure means by applying oil all over the body, you can apply, you can give this pindasveda. There means if there is no proper Amavastha. If proper Amavastha is there, of course, Ruksha type of pindas means Mukikiri will be helpful there. Especially doing in Sarvanga Shobha, Amavata, then Vata, Kaphacha, Sandhirogas, etc. While moving to Satailam Churna Pindasveda, last slide, please. Okay, just a minute. These are the main indications: Amavata, Staulya, Sarvanga Shobha, or Vata, Kaphaja type of Sandhi Rogas, joint diseases. Maybe this slide, I think you need more. Okay. Now, while coming to Satailam Churna Pindasveda, here, see, as I told, after applying Taila all over the body, the pottery is dipping to oil and heating the body. So this is the procedure of Satailam Churna Pindasveda. So here we can consider this procedure as a Ruksha Churna, Ruksha Sniktha type of Pindasveda. See here, 150 to 200 ml of Taila we have to use for different means for applying for the body and for dipping the pottery, for heating the pottery also. In general, to 150 to 200 ml of Taila should be needed for a single day. Here also, as I told, if two therapists are there, means 4 potteries should be there. If one therapist means 2 potteries are enough. See, Taila Churna can be selected according to the Rogavastha and Rogi. Of course, this procedure we are doing in a Vata Kaphaja condition according to the Shobha. We can select or according to the symptoms of that particular patient, we can adopt the Tailas. I think you can see here the Kotanjukadi Taila, Ketaki Muladi Taila, Karpasasthyati Taila. These Tailas are having more Vedana Haratva property. So if pain is a main symptom, of course you can select Kotanjukadi, Karpasasthyati, Ketaki Muladi, like that Tailas. Then see, of course, the properties will slightly change according to the Taila and Churna selected for the procedures. Means if you are using more Brahmana type of oils like Dhanundaram or Balashugandhadi, the property also will be different, or the indication also will be different. So this generally, this Satailam Churna Pindasveda is not indicated in a Namavastha. It will be effective in a shobha with degeneration, or in a particular shobha or inflammatory conditions like cervical spondylitis, like lumbar spondylitis, even some conditions like this one, maybe in some tendonitis conditions, this Churna Pindasveda, Satailam Churna Pindasvedas will be helpful. Even sacroiliitis conditions, any type of iliitis condition, means any type of itis conditions, this Churna Pindasveda, Jambira Pindasvedas, both of these procedures will be helpful. So as I told, cervical spondylitis, lumbar spondylitis, there and all, Churna in general we are selecting for making the portally. In case of ankylosing spondylitis, already we did in Vaidratnam, already we did one research on ankylosing spondylitis. We made a protocol there, and in 30 patients we did that. We applied that protocol, and we got good result that we submitted as a part of Center of Excellence project from Ayush department. We did this study, and already we had given that our study, all the papers to Ayush department, and already we published a paper regarding this. So there and all, for the ankylosing spondylitis, 2 procedures we selected for managing. See, only management only we can do. Ankylosing spondylitis is a yapya condition. It is difficult to cure that condition. We can't cure that condition. But we can give some management, or we can give some symptomatic relief over there. So for that purpose and all, in 30 patients for 7 days, we did Therapeutic sveda, and there I think the exact Thaila I'm not remembering for that research. I think Karpasasthyati Thaila we selected, I think. No, not Karpasasthyati Thaila. There we selected Ketaki Mulati and Panchatittaka Krida for external purpose in 3:1 ratio. In 3:1 ratio, Ketaki Mulati and Panchatittaka Krida we selected for the external purpose for doing Apyanga and for heating the portally, for heating the Tilapinda, means Tilapotally, and using that portally we did the Svedana all over the body. And in case of osteoarthritis, of course, there you can see in osteoarthritis and all, generally means of course there will be some degenerative changes. Along with that, like there will be some inflammations also. So there and all, Navadhanya, by frying and powdering the Navadhanya and making a portally using this Navadhanya and doing the procedure like that, we can give in osteoarthritis cases. In plantar fasciitis cases and all, Lavana pindasvedas will be helpful. There, of course, Valuka pindasveda as a ruksha pindasveda, in some cases we are adopting, or otherwise just by applying Kotanjukadi Taila, or in Vaidratnam, special oil is there known as Pinniyaka Tailam. In Vaidyaratnam, we are using this Pinyaka Thailam, especially in plantar fasciitis conditions. And applying that Pinyaka Thailam by heating in that area and giving heat over there using Lavana potali. So like that, different types of Churnapinda Sathail and Churnapinda Svedas we can give for different disease conditions. One question is there, I think. I think that question we can answer later. Yes. Now moving to Jambira Pindasveda. See, while coming to Jambira Pindasveda, Saindhava, see, this dosage is for making one potali. So generally for here 1 potali means 250 grams of that mixture should be there. Here see, comparing to Churna Pindasveda or Valuka Pindasveda, we are taking 200 grams. But in case of Jambira Pindasveda and Patrapinda, the mixture should be 250. Why? Because day by day that content will decrease. So the weight will decrease. So maybe for the first day that will be 250, maybe third day that will reach up to 175 or 200 grams. It's a type of Ruksha Sniktha type of Swedas. These are the ingredients for making Jambira Pindasveda. See here, all the materials and all the instruments we can see here for making the Jambira Pindasveda. See here, Jambira 800 grams, not for a single potali, for making 4 potali had written here. For Saindhava powder means 30 to 40 grams we can take for 4 potalis. Then turmeric, cotton cloth, thread, vessel for frying the Jambira, etc. etc. I think these slides I will provide after my session. There you can go through this. Yeah, comparing to other Swedas, this Jambira Pindasveda, Jambira is having Amla Rasa, and Amla Rasa is good for a Shobha condition, especially for external application. So it's more Shobhara, means here, as I told, in different itis conditions, means almost same like Churna Pindasveda. Jambira Pindasveda is also we can use for different inflammatory conditions. The change is in case of Churna Pindasveda, according to the selection of Churna there, the Brahmana or Lankhana nature will change. For example, if you are using this Tila in Churna Pindasveda, Snigdhata will be high. If you are using Navadhanya there, Navadhanya is having a like a mild Brahmana property. So by selecting the particular Churna, we can change the Brahmana property or Lankhana property there. But in case of Jambira Pindasveda, that type of manipulations are difficult. This Jambira Pindasveda is directly or specifically indicated in different itis, inflammatory conditions, especially as I told, bursitis, capsulitis, tendonitis, myositis, not musculitis, myositis for muscle inflammation, cervical spondylitis, lumbar spondylitis, sacroiliitis. So there and all for enhancing the Shobhara or anti-inflammatory property, you can select Chinjadi Taila or Panjamla Taila, like that, more like anti-inflammatory or more shobhara type of tailas we can select for the for doing Jambira Pindasveda in these conditions. These Jambira Pindasveda is having a specific indication in upper part of body, especially upper part of body we are considering as a kaphasthana. So if that's why in cervical spondylitis condition or frozen shoulder or capsulitis or like that condition, or bursitis, in those conditions, especially in shoulder joint and all, there and all, this Jambira Pindasveda comparatively it's more indicated, and logically we are selecting for the procedure. Some questions are there. Can we use normal lemon if Jambira is not available? Yeah, of course, I think. Can you give some more Taila options for Jambira Pindasveda? I think already we discussed means Chinjadi Taila, then Panjamla Taila, even Karpasasthyadi Taila, Karpuradi Taila, Kottamchukadi Taila. See, Tailas also we can, as I told in case of, first I told from Ruksha to Snigdha, we can categorize this Pindasveda. Tailas also we can categorize from Ushna to Shita, or from Ushna to Brahmana, like that. Means some oils are having more Ushna Vidya, some oils are having some Shita Vidya and Brahmana property. For example, Kottanchukadi is having Kottanchukadi, Chinchadi, Karpasasthyadi, those tailas are generally Ushna in nature. Balaguluchiadi, Pinda Thailam, Murivenna, those oils are having like they're having Vata Pittahara in nature, and it's having more Shita Virya. Some oils like Dhanundaram oil, Balasugandhadi, Taila, like that oils are Brahmana in nature. So like that, we can categorize the oil, and accordingly, according to the disease condition, we can select. In case of Shobha, in which direction we have to do the Sveda? Generally, Svedas we are doing in Pratiloma Gati. I think even in Shobha also in Pratiloma Gati we are doing, and in joints, if some type of Shobhas are located in some joints, means round or rotations like that movement also we are adopting for the massage. Rotatory movements we are adopting for the massage. In case of Shobha, in which direction? Okay, opposite to hair follicles, not opposite to hair follicles. Annalepa we are doing opposite to hair follicles, and Udvartana we are doing opposite to hair follicles, means Pratiloma. But generally all other Svedas we are doing in Aniloma Gati. Can we use Kottanchukadi Taila? Yeah, of course. In Jambira Pindasveda we can use Pinyaga Taila in panular fasciitis, which Surna we can use for Pindasveda. Lavana, only Lavana, means frying Lavana and powdering. Okay. I think we can move to Patrapotla Sveda now. Yeah, Patrapotla Sveda. See, Patrapotla Svedam is a junction between the Ruksha type of Swedas and Snigdha type of Swedas, or otherwise we can say from means all other Pindasvedas already we explained here are having means Amahara Swabhava, or otherwise Shobhara Swabhava. All other means all the Pindasveda that already we discussed, all those having Vata Kaphara nature. But comparing to Patrapotla Sveda, means while coming to Patrapotla Sveda is having a little bit Brahmana property also. That little bit Brahmana property comparing to Jambira pindasveda comparing to Churna pindasveda, Patrapotla sveda is having a little bit Brahmana property. Why? Because you can see the see Vatahara type of leaves we are using here, coconut peel we are using here, lemon we are using here, Erenda Taila or sometimes Nimba Taila we are using for making the pottery, for frying the leaves here. See, and Saintha also we are using. So here you can see coconut peel, you can see lemon, you can see Saintha, you can see. Coconut peel means it is Mathura rasam, and lemon means it is Amla rasam, and Saintha means it is Lavana rasam. So Mathura, Amla, and Lavana rasa we are using in case of Patrapotla sveda. So I think all these three rasas are Vatahara in nature. So all the three rasas which is having the Vatahara nature that we are using in Patrapotla sveda. So Amla, Mathura, Lavana, Sniktha, all are Vatahara in nature. So that's why even in a degenerative type of Vata Vyadhi also, we can adopt the Patrapotla sveda. See, these are different leaves that we are generally using for the Patrapotla sveda. Erenda Thailam, sorry, Erenda leaves, Nirgundi leaves, Arka, Karanja, Chinja, Datura, and Shigru. These are some common leaves that we are using for making the potteries according to the availability and according to the disease conditions. Sometimes in some disease conditions, some particular leaves will be more effective. That I will discuss next. So these are different leaves. Nirgundi, then Chinja, different types of leaves that we are using, the Patrapotla sveda. Vasha. So see, here you can see all the ingredients, Jambira, then Erenda Thailam is there, powder is there. In sometimes Shata Pushpa or Shatahua powder also we will add there. Then coconut peel is there, Sainthaum is there, different leaves you can see there. So these are the ingredients of Patrapotla svedam. Different ingredients of Patrapotla svedam. I think already we are running late. So I think after this session, I will provide these slides to the organizers. Then I think they can provide to them, to all the participants. This is the preparatory method. Here, 2 layers of cloth we are using for making the pottery. See, while coming to the indication, as I told, it is Vatahara in nature, Vatahara and Vedanahara and Shobhara in nature. So effective in degenerative and inflammatory diseases. See here, in rheumatoid arthritis, means in primary stage, if predominant AMA symptoms are there, means either we can go for like Valuka sveda or sometimes Dhanyamradhara according to the prakriti of that patient. If it is more Vata Paitika symptoms or Pitta prakriti we are seeing in that particular patient, means Ruksha type of Dhanyamradhara will be effective there. And all those treatments we can provide in primary stage. In second stage, you can give this Patrapotla sveda. Of course, in case of rheumatoid arthritis and all. In hemiplegia cases and all, see like 2 types of paralysis we can see. Maybe in flaccid and spastic paralysis. In flaccidity, in flaccidity, dhanyamladhara, like that, Swedas we are giving more, and in spasticity, there more ruksha, snigdha type of treatments like Patrapinda, then kaya seka, like the treatments we are giving in hemiplegia conditions, means according to the spasticity and flaccidity of that patient. In osteoarthritis and all, if we are after managing the amavastha, you can give this Patrapinda there. As I told, in Sarvanga Shobha, by making the potali by 50% of chinja leaves. In like that, if you are making the potali and giving the procedure, means it is more effective in case of Sarvanga Shobha condition. In case of Gridrasi, in Gridrasi, 50% of Nirgundi leaves and 50% other ingredients. Like that, we are making the potali and giving the Patrapinda, and that also clinically we are observing good result. In Apabahua condition, Shigrupatra, Lashuna, Satahua, Sarshapa, this combination making the potali and giving the heat application, means clinically we are observing good result. In psoriatic arthritis, generally in psoriatic conditions, it is difficult to go for different potali svedas. But in case of psoriatic arthritis, by avoiding Jambira and Saindhava, and by adding more Tochia type of leaves, like for example Nimba Patra, Karanja Patram, Varuna Patra, then Guduchi Patra, by adding turmeric powder, and by using Murivenna or Dashamula Amrada Taila, or Balagulushia Taila, or Pinda Taila, by for the external application. In psoriatic arthritis cases also we are giving Patrapinda. Some questions are there in inbox. Okay, thank you. Moving to next slide. Under pindasveda. See, under pindasvedam, generally for whole body we are not doing that much. More than that, a pradeshika or in a localized area, we are doing it more. Two types of preparations are there. Either by taking the yellowish part of egg, or by frying it and by mixing with other ingredients. So two type of preparatory methods are there. Both will be effective in a degenerative condition, especially in ligament degeneration, in tendon degeneration, in those conditions and all. This under pindasvedam will be effective. I think in next slide, this is the preparatory methods. Of course, 12 Kukadandam is using for making four potali. See, this under pindasvedam is generally Brahmana in nature and Sandhanagara. So that's why in non-healing fractures, in ligament tear and all, we can give this under pindasvedam. So comparing to all other Swedas, all that already we discussed, this snigdha means this is more snigdha in nature. It is Vatahara and Brahmana, doing for both Pradeshika and Sarva Dehika, means comparatively for more Pradeshika purpose we are doing this under pindasvedam. As I told, in muscle wasting, tendon wasting, ligament tear, non-healing fractures, in those conditions we can give under pindasveda. In facial palsy, not in primary stage, in second stage. Primary stage, I think Panasa Patra Swedas generally we are adopting more. Panasapatra Sweda means just, or even Arkapatra Sweda. Arkapatra means just by heating Arkapatra, applying on face. Just by heating Panasapatra, applying on heat. By applying, means first of all, of course, there should be some massage using Karpasasya Taila, or for Vaidratnam we are having Rasa Tailam, say special medicine for Ardhita condition, facial palsy condition, applying that on face and heating the Panasapatra or Arkapatra in primary stage, and in second stage you can go for this under pindasveda. So according to the degenerative condition, you can select Hanundaram Kuramba, Balasugandhadi Kuramba, Mahasneham, Panchatiktaga Sneha, like that, or Panja Sneha, like that, oils, or even Kuramba, or means Kuramba means it's a Yamaka preparation, or otherwise even some kritas like Panchatiktaka krita, Gugulutikta krita, like that, krita preparations also we can give for the external application. Then Shashtika Shali Pindasveda, the maybe after that Annalepa is also there. In case of Shashtika Shali Pindasveda, 3 types of Shashtika Shali Pindasvedams generally we are adopting in Kerala practice. Sakshiram Shashtika Shali Pindasvedam. Sakshira means here making, means we are cooking the Shashtika in Balamula Kwatha and milk or Kshira Kashaya prepared using Balamula. We are dipping the prepared, means we are cooking the Shashtika in Kshira Kashaya prepared by Balamula Kwatha. And after that, same pottery, we are making that rice in a pottery and dipping that pottery in same Kshira Kashaya prepared by Balamula Kwatha, and doing all over the body. That also will be effective. Means that generally these procedures will be helpful in Kevala Vadiga condition. In for the more Brahmana purpose, generally it's doing all over the body. And Sakshiram Samisham means by adding, as I told, 75 grams of Nyavara and some 50 grams of Mamsa for a single pottery, cooking in Balamula Kshira Kwatha and making the pottery and applying on the body. See here, in case of Shashtika Shali Pindasveda, daily we have to change the pottery. Sakshiram Shashtika Shali Pindasveda, Sakshiram Samisham Shashtika Shali Pindasveda. In these 2 types of Shashtika Shali Pindasveda, 1 layer of cloth is enough for making the pottery. Why? Because here we are squeezing that pottery and applying all over the body. So the contents inside that pottery will comes out, and that direct touch to the skin will be there. And one more thing, while doing the procedure, while doing the Shashtika Shali Pindasveda, before and after we have to apply the oil. Why before and after? Generally before we are applying in all other Pindasvedas, but after we are not applying. But in case of Shashtika Shali Pindasveda, there is chance for shivering due to the cold nature of Shashtika. Due to the hyper cooling nature of Shashtika, there is chance for shivering. So for avoiding that shivering, just after the procedure, after taking that Shashtika from the patient's body using tongue cleaner, or even using the leaves of coconut, or even X-ray sheets we are using for taking the Shashtika from the body. Sometimes Ruxin sheets we are using for taking the Shashtika from the body. So after taking the Shashtika paste from the body, once again we have to apply the heated oil for the body for avoiding the complications. These are different ingredients of for the making Shashtika Shali Pindasveda. See, this is the preparation. First, we have to prepare Balamula Kwatha. And to that Balamula Kwatha, we are adding milk and boiling. And that mixture we are dividing into two parts. One for cooking the Shashtika rice and one for dipping purpose. So total 4 liter of kshira and Balamula Kwatha mixture will be there, that we are dividing into two, and one for dipping purpose and one for cooking purpose. So this is the general preparatory method of Shashtika Shalipinda. So see here, the potally size should be more. Potally size should be 6 angulas. Why? Because we are dipping that potally in the kshira kashaya and doing the procedure. So for this as a safety measure, 6 angulas size should be there for the handle of pottery. As I told, Sakshiram Samisham Shalipinda Svedam is more Brahmana than Sakshiram Samisham. Sorry, Sakshiram Samisham is more Brahmana comparing to Sakshiram Shalipinda Sveda. More effective in Vata and Vata Paitika type of Vata Vyathis. More effective in neurodegenerative disorders, even in Parkinson's diseases and all, in cerebellar ataxia. In those conditions, we are using this Shalipinda Sveda effectively. Even in muscle wasting, maybe due to some motor neuron diseases and all, there also, not in primary stage, after removing the Amavastha or Avaranavastha, we can come to Sakshiram or Sakshiram Samisham Shashi Shalipinda Sveda. And in Vaidratnam, one more variety is there for the Shashi Shalipinda Sveda. That procedure is known as Satailam Shashi Shalipinda Sveda. In case of Satailam Shashi Shalipinda Sveda, what we are doing means there the cooked rice that we are tying in a pottery, and that we are heating in oil and applying on the body. See here, we are not dipping that pottery into Kshira Kashaya mixture. Instead of that, we are heating that pottery in oil and applying the on the body. So here, same as Churna Pinda Sveda, same as Patrapinda Sveda, we are doing the procedure. We are not squeezing that pottery too much. And of course, for making the pottery, 2 layer of cloth we are using. So like that we are doing in Satailam Shashi Shalipinda Sveda, and it is effective in Shopha Sahita Dhadukshaya Vatavyasi. For example, osteoarthritis. You know, in osteoarthritis, there you can see, of course, Vata Purna Dhisparsham Shobham Santigadonila Prasarana Gunjanayo Prodipim Shasa Vedana. Means Shobham Santigadonila. You can see Shobha in different joints. Along with that, Prasarana Gunja, crepitus also we can see. So in these conditions, you can give this Satailam Shashti Shalipinda Sveda effectively. So if you're suspecting a degenerative condition there, and along with that mild inflammatory condition is there, means of course Satailam Shashti Shalipinda Svedam is an logical selection. As I told, osteoarthritis, gouty arthritis, varicosity. In varicosity, in gouty arthritis condition and all, Satailam Shashti Shalipinda Svedam is effective. Already we did a research as a part of, as I told, even in osteoarthritis also we did one research as a part of extramural research approved by Ayush department, and as a part of Center of Excellence project, we did in gouty arthritis one research we did using this Satailam Shashti Shalipinda Sveda. Even in gouty arthritis condition also, this Satailam Shashti Shalipinda Svedam was effective. See here and all, not only by giving this Pinda Sveda, along with that internal medications also we have to give. While coming to Annalepa, almost 20 to 50 grams of Shartika is using for the preparation. Here, we are making, means cooking the rice, and that prepared rice we are applying all over the body in and moving or massaging or giving a hard massage in a pratiloma gati. Same as Uddvartana, in a pratiloma gati, we are doing hard massage using this prepared anna or prepared rice or cooked rice. So if it is a vata predominant condition, bala, using bala or dashamula, we can prepare kshira kashaya, and in that kshira kashaya you can prepare this or you can cook this anna. If as a part of psoriasis management also, we are giving this annalepa there and all, aragotha, yashtimathu, nimbatwak, using those more twachya type of kashayas, we can make like kshira kashaya, and using that we can cook the shashtikashali, and that also we can apply all over the body. That rice also we can apply all over the body. So here also, as I told in Sakshiram Shashtikshali Pindasveda, here also before and after you have to apply oil. For avoiding the complications like shivering and all, before and after you have to apply the oil. So in case of children, we are doing this Shashtikshali Pindasveda, sorry, Annalepa more, especially in cerebral palsy conditions and all. Yeah, these are the indications. Of course, as I told in Shashtikshali Pindasveda, in neurodegenerative diseases, multiple sclerosis, MND. See, generally neurodegenerative diseases are very difficult to manage. Means yapya, or we can say some are asathya. So symptomatic relief we can provide to the patient, or otherwise the growth of disease we can arrest or we can delay by doing all these procedures. As I told, in skin diseases also, especially as a part of psoriatic management and all, Annalepa we can use as a part of Karsha Chikitsa, as a Karsha Chikitsa for the nourishing purpose. We can give this Annalepa for externally. As I told, in cerebral palsy in children, we can use this procedure, Annalepa. These are the three complications generally we are observing while doing svedas: shivering, fainting, and rashes. Shivering, maybe especially we are seeing in two conditions. Sometimes it may be due to overheating, maybe due to over svedas, or there stands for some electrolyte imbalance and all. There stands for shivering and fainting. Of course, there should the procedures we have to stop, like a proper means different dravadrivyas inside. We have to give for balancing that condition. And sometimes there stands for rashes, maybe due to hyper and shivering. One more thing, and in shivering maybe may happen even in Shashtikshali Pindasveda also, maybe due to, as I told, maybe due to the coolness of Shashtikshali Pindasveda. There stands for shivering there. Of course, we have to stop the procedure, and using a thick blanket, we have to cover the body after removing the Shashtika all over the body. We have to give some hot water for drinking purpose. Those type of managements we have to do. Then in rashes and all, if sometimes in Pitta Prakriti or in a summer season, if you're doing Pindasveda, there stands for rashes. Of course, Mathu and Krita we can apply externally, or Sadathavda Krita or Murivenna we can give for external purpose. These are the main complications, and we are observing maybe due to atisveda. And see this combination, the Dakshadi Kashayam, especially in fainting and all. Sometimes maybe due to sugar loss, maybe due to electrolyte imbalance, maybe due to the what we can say, if that patient is not having proper body strength, there is chance for some complication there and all. This combination Drakshadi Mantha we can give by preparing like this, means 50 ml of Drakshadi Kashaya by adding 60 ml of water, 1 teaspoon of honey, 2 teaspoon of malar podi, means laja powder, 1 teaspoon of sita powder, then 1 dhanundram tablet for vata and lomanatwa. By mixing all these ingredients and giving as a single dose is an effective remedy for atisveda lakshanas. Not only for atisveda lakshanas, sometimes even while doing vasti, there is chance for some like fainting and all. In that complication also we are giving same combinations we are giving, even in complications of vasti management also. So these are so in this session we discussed different types of sveda. First of all, we discussed we graded from ruksha to snigdha. Then the logicals, how we are selecting, the different type of pindasveda according to the dosha avastha. That also we had discussed. After that, 10 pindasvedas we discussed, the procedure, the preparation, the logical selection behind that, the indication, all those things we had discussed. And also we discussed the general complications that we are observing while doing pindasveda and its management also. So thank you. I think that we can move to the discussion part. Some questions already I answered.
Thank you, sir. Thank you very much for taking your time to prepare for such an extraordinary, enlightening session, which was incredibly informative. So we will now go ahead to the question and answer session. Shall we begin, sir?
Sure. Yeah, sure. Some questions already I answered. I think already.
So shall I read out the question?
Yeah, sure. From 8 till 8:34 I answered. After that we can discuss, I think.
Okay, sir. So in case of a dermatomyositis where
Yes.
CPK is increased, what we can do?
In dermatomyositis where CPK increased, what we can do? See, in dermatomyositis and all, I think that management will be same as psoriatic arthritis and arthritis cases. There, according to the body strength, we have to adopt the pindasveda. Maybe more than that, dravasveda will be helpful there. Maybe kashaya dhara or kshira dhara, like that treatments we can adopt. If that patient is ready, or if we can go for a pindasveda, means patrapinda we can adopt there. That combination I told in case of psoriatic arthritis, like more twachya type of ingredients like nimbattvak, aragvathattvak, yashti, etc. That combination you can adopt.
Thank you, sir. So next question is, which pindasveda you recommend for varicose vein?
Of course, as I told, 2 svedas we can do there. Patrapinda svedas we can do, and there means in varicosity, not in ulcerative conditions and all. In primary stage, these 2 type of Svedas. In primary stage, Patrapinda Sveda, and in secondary stage, Satailam Shati Shalipinda Sveda. Not Sakshiram, Satailam Shati Shalipinda Sveda also will be effective.
Thank you, sir. So, which oil is used in facial palsy?
Facial palsy, as I told, as a part of Vaidyaratnam tradition, I'm practicing. So here we are using Rasatailam mainly. Rasatailam we are using. Even Karpasasyati Thailam also we can use in case of facial palsy, especially in initial stage.
Thank you, sir. I'm sorry, delegates, due to shortage of time, we have to stop the discussions here. Thank you, sir. Once again, it was really a very wonderful session. And now we have a very special announcement. DIKSHA Academy is very proud to announce Keraleeya Chikitsa online lecture series on unveiling the traditional secrets of Kerala's monsoon treatment protocols and discovering the legacy of Ayurveda. Monsoon is coming. Grab this only 1 hour opportunity to equip yourself the best knowledge ever known for Karkidaka Chikitsa from its year-old ancient roots. Don't miss this opportunity. It is nearing soon. And I request all of you to grab this opportunity as soon as possible and know more about Keraleeya Karkidaka Chikitsa from DIKSHA Academy. Now, I would like to call.
Just a minute, doctor.
Yes, sir.
Finally, just I want to say my sincere gratitude to Team DIKSHA for giving me a wonderful chance to share my knowledge, especially regarding the different types of Svedas. All these procedures we are doing here in our center, in our hospital, in our Ayurveda college. So I think you can provide even my personal number to the participants if they are having any doubts regarding this session. They can call me directly. I think I can clarify any doubts regarding this topic. Thank you.
Thank you very much, sir. So now I request Dr. Ashwati, Ayurveda College, Coimbatore, to deliver the vote of thanks. Over to you, ma'am.
Hello, am I audible?
Yes, ma'am.
Yes, ma'am, you're audible, ma'am.
Okay. Good evening, everyone. On behalf of Ayurveda College, Coimbatore and Team DIKSHA, it's a privilege and a great joy for me to extend a vote of thanks for today's session. First of all, I would like to express my sincere gratitude to Dr. Navaneeth Krishnan, sir, for showing light into the topic pindasveda, Keraleeya Vaividhya and Prayoga. I'm sure that the participants are immensely benefited by being here. We are all inspired by your words, sir. Definitely, it was an excellent session, very deep and pinpoint knowledge regarding different pindasvedas. Thank you so much, sir.
Thank you.
Also, I extend my thanks to our delegates here who are untiringly taking part in our sessions. Hope to meet you all in our upcoming sessions also. Thank you, one and all. Thank you.
Thank you, ma'am. It's the province of knowledge to speak, and it's the privilege of wisdom to listen. Thank you all for patient listening and the valuable time spent. To know more about our updates, please do stay connected with our social media platforms. That's all for today's most interesting session, with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.